It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: bad breath and how to keep your dog's gums healthy. Bad breath is more commonly called halitosis and is the result of bacteria in your dog's mouth and teeth. Odor indicates dental disease and, when severe, can indicate a more advanced form of dental disease called periodontal disease, in which the underlying bone is affected. Although halitosis is not considered an emergency, your dog could have an uncomfortable or painful mouth, so you should treat it as soon as possible. Other mouth odors can also be the result of diabetes or kidney disease. If your dog does not seem well, is eating poorly, or is lethargic, an emergency should be considered. If no other signs are present and everything seems fine, halitosis can be treated without being an emergency. How to keep your dog's gums healthy. Gum disease is painful and can lead to other problems in the body, such as kidney disease or heart problems. These can be caused when bacteria in the mouth travel through inflamed gums into the bloodstream to infect other organs. Regularly check your dog's gums. Check them at least once a week and whenever you see or smell something that doesn't look right to you. Brushing your dog's teeth is also a very healthy habit that improves oral health. You'll quickly learn what's normal for your dog's mouth, so you can see what changes over time. Most dogs will develop some degree of dental disease as they age. Having your vet closely examine your dog's mouth and teeth at each visit, as well as any time he notices something amiss, will help you catch problems before they become serious. Dog gum health checklist. At least once a week, when your dog is relaxed and cooperative, take a look inside his mouth to see if there are any changes. Here's a guide to what to look for. 1. Look at the color. The inside of the mouth should be about the same color as yours, a bubblegum pink with a wet, slippery surface. 2. Check for growths. Look for raised areas, lumps, bumps, sores, or bleeding spots. Anything that is a different color than the surrounding gums should prompt a visit to the vet as soon as you can. 3. Check for swelling, bleeding, and receding gums. These signs are more worrisome and may be an emergency. If you find an area in your mouth that looks raw, swollen, or bleeding and you don't know the cause, it should be checked. Also, if your dog has receding gums, these may be secondary to periodontal disease. While this is not an emergency, it should be viewed as a priority. Check for overgrowth. Dogs sometimes have gums that overgrow to the point of hiding their teeth. They are usually pink and healthy looking and firm to the touch, but there is clearly more tissue than there should be. These should also prompt a non-emergency veterinary visit. 5. Are they wet or sticky? Normal dog gums are wet and slippery. Sticky gums can be a sign of dehydration, and if this persists for a few hours, it's definitely cause for concern. 6. Is there a smell? It helps to know what your dog's mouth normally smells like. Obviously, this will change, especially if your dog has been looking for treats in the cat box or tasting a roadkill on his walks. But as a general rule, there should be minimal odor on the dog's breath. If your dog's breath always stinks, dental disease is certainly a possibility. If your dog also seems sick, bad breath could be an indicator of kidney disease or diabetes. 7. Check if the tartar touches the gum line. In some animals, tartar can accumulate in plaques and touch or even overlap the gums. This is very painful and can lead to periodontal disease. Dogs with tartar that is at or on the gum line need immediate dental treatment to keep their gums healthy. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.